record on this computer. Hi. Hi, Lynn.
Hi Tracy. How are you?
I'm good. How are you today?
I'm doing great today.
Good. So I wanted to meet with you. I know you. We've known each other for a long time. I haven't talked to you like in person for a while. We also have Sonia Dove, who is on the line with us too from Mexico. She's calling to listen to our information with Lynn today. We're all friends. We all know each other back from the Wella days. I used to work at Wella, God, way back when, like, I don't even remember when, late.
More than 10 years ago, because I haven't done hair in 10 years.
Yeah, it was like the late 90s, I think, when I worked there. So Sonia Dove was the creative director for Wella. I believe she still is the creative director for Wella. If you want like amazing hair and hairstyling, look no further than Sonia Dove. And then Lynn was a hairstylist that worked with us through Wella, who went out to the salons to train trainers. She did a bunch of like really cool information, worked with Sonia as well, and like learned all these cool techniques. And that's why they have like amazing looking hair right now. But Lynn and I have remained friends for a while. And Lynn, as most of you know, I sell wine. So one of the things that we do through One Hope is that every one of our bottles of wine is partnered with a nonprofit. So there's a nonprofit called the Ovarian Cancer Research Alliance that is partnered with all of our rosés. So through your purchase of a rosé through One Hope, you not only are getting great wine, but you're also donating back to the Ovarian Cancer Research Alliance Foundation. To date, we've funded 4 million women being educated on the risks and symptoms of ovarian cancer by people purchasing this wine. So it's quite impactful, which leads me into Lynn, because Lynn is an advocate for Ovarian Cancer Research Alliance. So she's going to share with me and with all of us, because that's what we're here for. Knowledge is power, right? What is ovarian cancer? She's going to tell us her story. She's going to go through some of this stuff, and I'm just going to turn it over to you, Lynn. And if you have any questions, you can type them in the chat, or Sonia, you can unmute yourself and jump in too. But Lynn, share with us all your knowledge.
Good afternoon, everybody. And my name is Lynn Narcan. I am an ovarian cancer survivor. I'm 69 years old. I'm married for 50 years to the love of my life. I have 2 adult children, and I have 4 grandchildren. I retired from hairdressing in 2010 after working in my salon, and as Tracy said, working for a major hair color company. Now I'm retired, and the most work I do is for ovarian cancer. At the moment, I'm making masks, and $1 from every mask that's sold goes to our foundation. So I think it's a good cause. I feel like, I have to give back in some way. So I have a question for everybody. How many of you ladies go to your gynecologist and get a pap smear and get a mammogram every year and think you're safe from ovarian cancer? Well, I hate to tell you, but you're not. A pap smear only detects cervical cancer. Ovarian cancer does not have a test. It has symptoms, and you have to know the symptoms to tell your doctor. So nobody is safe from ovarian cancer. If your gyno does not ask you questions, you need to ask him. You need to be proactive for your body. I am an advocate for ovarian cancer, OCRA, Ovarian Cancer Research Alliance, and I go to medical schools, LSU mainly in New Orleans, and speak to students that are in rotations. So they're from all different degrees of doctor. They don't have to be a gynecologist or an oncologist. We want all the doctors, every doctor you see, to know the symptoms of ovarian cancer because they're so vague. So we have a group and we go once a month and we share our stories with these doctors, and we allow them to ask us questions on where we're at in our treatment. And we always suggest to them to ask questions. If you have a backache, find out what that backache's about. If you have GERD, find out what it's about, because those are two symptoms of ovarian cancer that doctors usually don't put together. Yes, Tracy, you have a question?
What is GERD?
GERD is like reflux.
Okay.
It's when you burp a lot, when you eat and you burp a lot.
Okay.
So, and that's one of the symptoms. So, we help them understand where we're at in our lives and how to detect in their patients these symptoms. So let me tell you a little story about myself, how I found out that I have ovarian cancer. In the fall of 2018, I started to have incontinence. And I've had 2 bladder lifts being a hairdresser, standing on my feet. I'm a hairdresser 50 years now. Standing on my feet, I just attributed to standing on my feet and having children. So I had one in the 80s, and then in the fall of 2018, I started having incontinence again. And actually, I had 2. I had another one about 9 years ago. And so I thought, why are these failing? What is happening? I've had 2 bladder lifts, and I'm still urinating all over myself. So I went to a urologist. She did a bunch of tests, mostly for my bladder. She thought I had overactive bladder. Well, I was in the shower one day as I was going to this doctor, and I felt a lump on my partial hysterectomy scar. So the next time I went to her, I showed her the lump. She suggested a CAT scan. So we made the appointment, went back in for the CAT scan, February 15th, 2019. Did the CAT scan that morning. We did some more bladder tests in the afternoon. We went back to her office that afternoon, and she pulled up the CAT scan on her computer and took one look at it and walked out the room. My husband and I looked at each other and thought, oh my God, we were in a panic. We didn't know what to think. We had no idea what we were looking at. We could see 2 big black holes, but we didn't know what those holes were. A few minutes later, she came back in, and I don't think she realized what she was looking at. She came back in and explained that I had 2 tumors. One tumor was about 7 inches, and one tumor was about 4 inches, and that I should see a gynecological oncologist immediately. So my physician hooked me up with my 2 doctors, who are Dr. Nair and Dr. Jernigan, and my hematologist, who is Dr. Marquette. Dr. Jernigan and Dr. Nair are LSU doctors, and Dr. Marquette is a local regional hematologist. So now I would like to show you a slideshow of the symptoms. It just takes 1 minute to load. Okay, can you see it? Because I can't see you.
No, we can't see your slideshow.
You can't see it, okay. This is the program that we teach at LSU and other medical schools. And we're also trying to get into nursing schools, because nurses need to know this too. And this is the same exact program that we teach to students that I want to tell you about. So it's called Survivors Teaching Students, Saving Women's Lives. So anyone born with ovaries can develop ovarian cancer. So that means an infant can have ovarian cancer. You can have ovarian cancer when you're 98. You can have ovarian cancer when you're transvestite, after you've changed and you've had everything removed. You can still have ovarian cancer. It affects every woman of every age. I should say every female. So ovarian cancer by the numbers, 11th most common cancer in women. Over 200,000 women in the US are living with ovarian cancer. It's the deadliest of all gynecological cancers and the 5th leading cause of deaths among American women. These surveys have been done in the USA only. In 2019, 22,530 American women will be diagnosed with ovarian cancer. 13,980 will die. That's more than 50%. 1 in 78 women will develop ovarian cancer in her lifetime. It's a very small number considering the number of women in the United States. Well, I'm going to skip this one because this one's really just for the doctors. So early detection is difficult. The majority of patients diagnosed with ovarian cancer are diagnosed in the later stages. There's no screening for ovarian cancer. Although I'm going to insert right now that OCRA was granted a $4 million grant this year to come up with a test for ovarian cancer. And it was divided amongst the most prestigious hospitals around the United States. Boston University, Johns Hopkins, MD Anderson, they all got part of it. And that's all they're going to do is try and find a test to give us, like a pap smear, that would detect ovarian cancer. A pap smear does not detect ovarian cancer. In some cases, ovarian cancer has symptoms in the early stages. Usually that happens when you're young, not when you're older. The risk factors: increased age, personal or family history of certain cancers, breast cancer, ovarian cancer, uterine cancer, and colorectal cancer, and certain genetic mutations, including the BRCA1 and 2 and Lynch syndrome. Lynch syndrome is a hereditary disease. Some people of Jewish descent also carry this gene. And the reason that they carry it is, I never could say this word. My doctor rolls it off her tongue like that, and I can't say it. She told me that she was trained in New York, where there's a lot of Jewish people. And Jewish people of this descent have arranged marriages. And sometimes these arranged marriages are cousins, so both carry the gene. So that's why it is so high in this Jewish descent, because they both carry the gene and then they hand it to their children. Hormone replacement is another factor. If you have more menstrual cycles, if your cycles aren't regular and you have them like every 3 weeks instead of every 21 days, I think it's been so long since I had a cycle, I can't remember. Hormone replacement, I've done for 30 years, to let you know. Obesity, I had lost 35 pounds about 2 summers ago. And if I wouldn't have lost that weight, I wouldn't have felt that lump. So that helped me tremendously to lose that weight. And endometriosis, if you have endometriosis, then you should really get checked more often. The protective factors are, and this is, it's kind of contradictory in some people, if you have your ovaries and fallopian tubes removed. Childbearing, more children you have, the less your ovaries work. So the less chance of them being diseased. Breastfeeding, because you don't ovulate when you're breastfeeding. Oral contraceptive use, so if you've used contraceptives for a number of years, I don't say it protects you 100%, but it does help your risk factors. And a tubal ligation, which I've had when I was in my 30s, so that didn't protect me. Now, some women, they don't have any children, they've never had children, but they've been on birth control pills for their whole sexual life. So it's kind of like a double-edged sword. It's okay that you don't have any children because you're protected on the other side using the oral contraceptives. You don't want your ovaries to work. That's the main thing. When they don't work, that means that the disease cannot grow. Removal of the ovaries does not eliminate the risk of developing primary peritoneal carcinoma. Your peritoneal covers your sexual organs. It's a sheath that covers your sexual organs. So even if you had a total hysterectomy and you still have your peritoneal, if one cancer cell was left in your body, that cancer cell could permeate into the peritoneal and you could get cancer. So you don't even have to have an ovary to have cancer, which many people think that since I had a total hysterectomy, I don't have to worry about it, but you still should be checked. The symptoms are bloating, urinary frequency or urgency, pelvic or abdominal pain, difficulty eating or feeling full quickly. These are just some of the symptoms. I have a card that I hand out in all of my classes, and I give these to all the women to keep and to check every now and then if they're having any of these symptoms. So also, if you've had a family history of breast cancer or ovarian cancer, and I've said before, if you have BRCA1 or BRCA2, that's a genetic mutation. If you have reflux, if you have back pain, the incontinence is a big thing because usually the tumors are pressing on your bladder, and that's a big thing that you should look for. So there's many, many symptoms that we take for granted every day. I mean, in Louisiana, we eat a lot of seafood. So we eat the seafood over the weekend, come Monday, we're bloated. So we just take that for granted. But a lot of times that's not the fact. It just bloats you more. You're already bloated. And as we get older, and especially hairdressers, standing on your feet, you're gonna have incontinence because that bladder is gonna fall. And like I did, I thought it was from standing on my feet all those years. And I had no idea that that was a symptom of ovarian cancer. I did not have pelvic or abdominal pain because that usually comes toward the end. And you're pretty much in the fourth stage. Difficulty eating. I didn't have that at all. I mean, I lost 35 pounds through my own dieting. I've never had a problem eating. So, but I have had backache, and I attribute it to a car accident that I had, and I was treated for that and never asked about ovarian cancer. I have reflux or GERD. I have been taking pills for that every day for the last 10 years. And that is also a symptom that I didn't put together because I didn't know the symptoms. So studies have shown that these symptoms are more likely to occur in women with ovarian cancer than women in the general population. When ovarian cancer is suspected, when you have these symptoms that I just spoke about more than 12 times a month, or they're persistent over a 2-week period, and they are unexplained by any other causes. I actually have a diary that I hand out to women, and unfortunately, I can't share it with you today because it's on copy paper and it's black, so you wouldn't be able to see it on the screen. But I'm going to mail one to Tracy, and Tracy, you'll have it if anybody wants the information.
Awesome. I'd love to see that and share it at my tasting.
Yeah, what it does is it takes you through 2 weeks, and you go through the symptoms, and if you have the symptoms, you check the box. And if you have more than, I think it's 7 of these symptoms in a 2-week period, you need to see a gynecological oncologist just to be checked out. So when you go to your GYN, if you're young, you go to an OB/GYN, you should have a pelvic and a rectal exam if any of those symptoms are present. Most doctors do not do that. I did not ever have a pelvic and rectal exam until I went to my GyoNoc, which is short for gynecological oncologist. If you have cancer in your family, any kind of cancer, it doesn't have to be any of the BRCA cancers. BRCA cancers are any sexual organ in men or women. So it's breast, ovarian, cervical, fallopian, prostate, vaginal. Anything that's a sexual organ is considered a BRCA, can be connected to a BRCA gene. So if you have any cancer in your body, in your family, you should have a transvaginal or a pelvic ultrasound at least once a year. Even if your relative did not have a sexual cancer, you still should have a transvaginal. You have to ask for it. A lot of times insurance does not cover it. $1,000 would have been worth it for me had I known. As I go on in my story, I'll tell you how many people in my family were affected, and I didn't know. Also, a CA-125 blood test. If an irregularity is found in the above exams, the pelvic, rectal, or transvaginal ultrasound, a CA-125 is a cancer marker. What it does is it tells you how much cancer you have in your body. So if you don't have any symptoms and they don't see anything in the pelvic and the rectal exam or the transvaginal ultrasound, it's useless to have. Both my daughters have the pelvic and rectal exams. They're in their 40s, and they have a transvaginal once a year. They do not have a CA-125 because their pelvic and their transvaginal checks out fine. If the patient has any of these symptoms and the doctor finds that they do find irregularities in the exams, refer them to a gynecological oncologist, because studies have shown that women with ovarian cancer generally have a better likelihood of survival if treated by a gynecological oncologist. Age and ethnicity distribution. Ovarian cancer is more prevalent in women ages 55 to 64 years old, postmenopausal. However, ovarian cancer can and does occur in females, all ages, all races, and all ethnicities. So that's just have to figure out how to get it off the screen. I know how. Okay, escape out of it.
There should be a little button down at the bottom, Lynn, that says stop sharing.
Okay, we're back.
Perfect. Wow, that was amazing.
Yes, so you learn a lot of things that you don't realize that your body tells you, and you don't really recognize them until you put it all together. So how many of you had symptoms of this dreaded disease? The symptoms are so vague and everyday occurrences that we don't put 2 and 2 together. We know our own body, so we should know if these are everyday occurrences or symptoms. The numbers are staggering of postmenopausal women who are diagnosed in later stages. Postmenopausal women are the highest percentage of women diagnosed. We need to bring this to our doctor's attention and ask for a better explanation and examination. I didn't go to a gyno for 7 years. I'm ashamed to say. When I moved to Mississippi, I couldn't find somebody that I liked. So I thought, I'll have my mammogram every year. I had a partial hysterectomy. I'm good to go. Little did I know, I was wrong. Ovarian cancer can even be present, as I said, without ovaries. Back in our day, it was normal to remove the uterus and leave the ovaries for hormonal protection, to protect your bones from osteoporosis. So I had a hysterectomy in my late 30s, went into perimenopause in my early 40s, and then started taking hormone replacement for the next 30 years. How crazy was I? So those synthetic hormones were helping my cancer grow, but not one doctor told me that. So this is why you need to ask questions. Ovarian cancer is different from any other cancer the way it spreads. Most cancers mutate. So the cell divides and multiplies and then it joins together and it makes the tumor. Okay? Ovarian cancer sprays the cells. So usually it will spray onto the peritoneal and then onto the omentum and then onto other organs in your body. That's what happened to me. I had my ovaries, fallopian tubes, peritoneal, omentum, and I had my colon resected in 3 places because it had permeated my colon. I did not have colon cancer. I had ovarian cancer in my colon. It also can, if you have an appendix, it also can affect the appendix and any organ that is around your ovaries. It can spray onto and affect it. It's a chronic disease. It's not a disease that goes away very easily. The reoccurrence rate is 80%. So in my lifetime, I will probably have a reoccurrence. Hopefully I won't. I go to my GyoNoc every 3 months. She does the rectal and vaginal exam. We do CA 125 monthly to keep track of the cancer in my body. And I have a CAT scan every 3 to 6 months, depending on what that CA 125 number is. The normal number for CA 125 is 35. Right now mine is 282. But CA 125s are very unreliable and almost work like blood pressure. My mom had high blood pressure. So her normal blood pressure was 170 over 90. That was normal for her. For me, my doctors tell me that my high numbers are normal for me, that I will never reach that 35. When I started this journey and they did the first CA 125, it was 7,700. So I came down quite a bit, but we have to keep it that way. So I take a drug called a PARP inhibitor. The PARP inhibitor, it's very strong. It has many, many, many side effects, but it keeps me alive because it produces an enzyme that stops the growth of the tumors. Now, usually you'll go through a few PARP inhibitors in your lifetime if you're an ovarian cancer patient because they stop working after a while. Right now, I'm waiting I get my results tomorrow from a CAT scan that I had done on Friday. I've looked at the results. I'm not a doctor, but they look pretty good. It says nothing has changed. So we praying and have our fingers crossed that I'm learning how to read the results. So I was genetically tested for BRCA. It's a process. You go to a geneticist, which is the best. Some doctors' offices offer it, and the nurses do it. I would suggest going to a geneticist. They delve into it much further. I found out through speaking with family members before I went to her that we have 5 straight generations of sexual cancer in both men and women. And it goes all the way back to my great-grandmother in the 1930s. And I didn't know that before. No one had ever told me that. It was on my dad's side. So my dad, he just didn't talk about it. I am not BRCA positive. So it was a mutation. It's, I cannot pass this on to my children, thank God. If you are BRCA positive, 1 or 2, it's a 50-50 chance that you pass it on to your children, and on and on and on. I know one family, they have 7 children. The mother had breast cancer, and the grandmother on the paternal side had breast cancer. 6 out of 7 children, including 1 son, are BRCA positive. So that means all of their children will have to be tested, and they will have to be monitored throughout their life for cancer. Most men don't realize that prostate cancer is related to breast cancer. So if your dad or your uncle or your cousin or your nephew has ovarian cancer, prostate cancer, it's something for you to look into. And that's a reason for you to have a transvaginal ultrasound, because you have it in your family. When my original urologist diagnosed me with this disease, my husband and I thought I was handed a death sentence. We really did. We both sat in the car afterwards and cried. And then I had to tell my children, which was the hardest thing, and my grandchildren. But with the help of my wonderful doctors, all my friends, all the prayers that have been sent to me, the good thoughts, the good vibes, I'm still here. And I hope to be here for many, many, many more years. If I wouldn't have found that lump, I don't know where I'd be today. I had no idea what the symptoms of ovarian cancer were. I know now what to look for. I know now what to look for in my children and in my grandchildren, and they know too.
Oh, we lost her.
So my GYNOC recommends transvaginal if you have any cancer in your family. As I said, my daughters are at high risk, and they are examined every year, and they have a transvaginal. Just to be cautious, even though they're not BRCA positive, they still have cancer in their family. It doesn't mean that you can have just ovarian cancer. You can have any kind of cancer in your family, and you should be tested. If the insurance company refuses to pay for it, fight them, because they should pay for it. I think your gynecologists need to educate their patients more, and we would have less ovarian cancer deaths because we could catch it in the earlier stages. So we need to be proactive and ask them questions, and ask them why they're not telling us, so that the next patient that comes in, they'll tell them. Sometimes you have to put them on the spot. I learned a lot through my wonderful doctors and nurses, being an advocate for OCRA. If I can save one life, I feel like, and I cry every time I say this, God left me here to save one life. And if I can do it through these presentations, then it's worth every minute of every day for me. So no matter what your age, what your circumstances are, get an appointment with your gyno. Ask him the questions that need to be asked. Don't put it off. You can save your life. Thanks everyone for listening to my story. I hope no one has to go through this, and I hope I'm here for many, many more years to help many more women learn about ovarian cancer. Thank you for being with us today.
Wow, thank you, Lynn. When we had that little disconnection, Sonia and I were like, wait, what's happening? Wow.
It happens sometimes because I have a lot of Zooms with my doctors now. They don't want me to go to the hospital unless I have to, because I'm so immune compromised. So it happens in fact, one of them, she switched programs because it happened so much.
Yeah.
So.
Yeah. Sonia, did you have a question for Lynn?
Can't hear you.
Oh, wait.
Still can't hear you.
There we go.
I have two questions. Oh, perfect.
Okay, now I
have two questions. So the average person, like myself, I have a gynecologist or
You're frozen.
practitioner, and I have a pap smear every year, and I have a mammogram, just general. How do you get to go to an oncologist?
So if you have any of the symptoms, you need to go to a GyoNoc. Your sister had breast cancer. So you need to go to a gynecologist that will do the exams, that will do the transvaginal ultrasounds, and let you know the results of those. If there's any doubt he has or she has in her mind, you need to make an appointment with a gynecologist, oncologist. Okay? Was your sister, I can't hear you, you're muted.
So I only have a family practitioner, a family one. So I need to make a request through the regular doctor to see a gynecologist, or is it an oncologist? Which?
If it's just a regular doctor, a gynecologist first, because usually oncologists won't see you until you have symptoms.
Got you.
Okay.
Perfect.
Or if you're positive. So if you have genetic testing and it shows up in your blood, then you should definitely go to a gynoc.
Okay.
Since you do have it in your family. With Lisa.
My sister has breast cancer.
Rośe.
Rośe has breast cancer, but that's the only thing we ever have.
It doesn't matter. It can skip generations.
Okay.
Okay. So, because my great-grandmother had it, and then my grandmother didn't. But she produced 2 daughters that had breast cancer.
Wow. Okay.
Okay. And then those 2 daughters, my dad had 2 sisters and 2 brothers. And one brother's son had prostate, and I have ovarian. And my nephew has prostate.
Wow.
So it can skip generations, or it can just go right through like they did with mine. You know,
I have to say, sometimes it's difficult to get an appointment with a specialist
Really?
That's something I find difficult.
So you need to come and visit me, and I'll get you an appointment.
Okay. The other question is, what is an oncologist compared to a gynecologist?
My doctor specializes in ovarian cancer. A gynecological oncologist, her specialty is ovarian cancer. She doesn't do breast cancer. She doesn't, she has no surgeries with breast cancer. She is a surgeon that operates on patients that have ovarian cancer. The hematologist that I go to, she formulates the chemo, and she prescribes the PARP inhibitor that I take. But I must say that even though my doctors are not, they do go to the same hospital, but they're two different companies, the hospital is one company and LSU is an entity in itself. They communicate constantly. If I have any problem before I leave the office, each one of them will say, I'm going to call Dr. Marquette when you leave. I'm going to call Dr. Nair when you leave. So they have very good communication, and that's very rare in a lot of doctors that treat you. You walk out the room and you're just a patient. And I hate to say that about doctors, but it does happen. So if you look on your insurance form in your book or online, they usually will have a list of doctors that you can go to that are regional to your area. So that would be my first step, Sonia, is to go online, look at your insurance, and search for a gynecologist. Go to a gynecologist and explain to her what has happened in your family, how young Marisha was, and tell her you want a rectal, vaginal exam, and a transvaginal, even if you have to pay for it. It's worth every penny. It only costs here about $250 for a transvaginal ultrasound. So I don't know how much it costs in California. I wouldn't care. I mean, as much money as we put out. For instance, people don't, when people talk about drugs, they don't realize how much they cost. Tracy, I'm sure you do. My PARP inhibitor, if I had to pay for it, my copay is $4,400 a month. The total cost is $7,000 a month if I didn't have insurance. But my hospital works with companies that do grants. And if you qualify, they'll pay for your medication. And I do qualify. So I'm very, very lucky that I don't have to pay. I couldn't afford to take it. And that's what these foundations help with, the cost of the drugs. Wow. I didn't pay for any of my chemo because I qualified for a grant for that too. Although I can't even imagine what my surgery cost, because I was in ICU 4 days. I was in the hospital totally a week. I had home health 3 weeks, and I had 5 doctors. During my surgery, my spleen was nicked. So they had to call a surgeon in to remove my spleen. So I had 5 surgeons. I had 2 GyoNocs. I had a urologist, oncologist, because of the incontinence and because they found something wrong with my utero. But it's okay now. And then I had the general surgeon, and I had the colorectal doctor that did all the resections. So I have never seen a bill, and I don't want to. I went into major medical, so I went into major medical even before I went to have surgery.
Yeah. So that brings us to the point of the foundation that you are fundraising for too, that you're doing the masks for, and $1 of every one of your masks that you're making goes back to. Can you share a little bit about what the
Yes,
LSU
I
Health?
would be more than happy to. My two oncologists, started a foundation with LSU that helps indigent women. They work out of a big hospital in New Orleans called University Medical, and you have to be on Medicaid to be accepted at that hospital. So most people don't have the money. In fact, some women don't even have the money to get a taxi cab or a bus or a car ride to get to their appointments. So they started a fund that these women can use to get a taxi or a cab or a babysitter or a caretaker, and they can draw from this fund. And it's called the LSU Health Services / Gynecological Oncology Fund. So if you would like to donate, that is where my little dollars go from my mask, goes to that fund. And I will tell you this, when I do a presentation, I pass the bucket and ask for donations. And of course, with COVID, I had to stop. But between my mask and the donations that I got, and I'm not even up to date on my mask yet, I've donated over $600 so far.
That's awesome.
It is awesome. And it's not my money. It's somebody else giving it. I don't take credit for it. I'm only the middle person that gives it to the fund.
But you're raising the awareness and you're helping into, and that's all that we can do as humans. It's like we have to do that. That's why I do One Hope. I mean, I love
exactly.
But at the same time, it's like it makes such a big difference in the world. It's like, what? I'm surprised. I'm blown away sometimes by people or companies when they're like, oh, well, we need to think about that, or about emailing our people about buying one. And I'm like, why? You get 10%. I see you doing all this other stuff like Amazon Smile, and it takes so much money for you guys to raise money. Like, do this, do that. Like, there's so many things to do in the world. So that's why it's like we're passionate about it. And I'm so honored that you shared your story with me today, and that we can share it with our social channel. So we'll post this, and that you touched me so much when my mom was going through all her cancer.
I know, and I still pray for your mom every day.
And it's just,
and you too.
I'm so glad that you're here. I'm so glad that you are still here to share this journey and to make an impact and to do good in the world.
Thank you, Tracy. I do it out of love and because I feel like I owe a life. Yeah. That's my goal, to save one life.
You're awesome. Well, I'm going to make sure that I post, can people contact you directly? Like if we post this on Facebook, can they contact you on?
Yes, absolutely. And I can mail them information if they need it, or I can post it on, private message them the information if they would like. I just want to get the word out any way I can. My doctors are very helpful in helping me get the word out. I wished I had their picture. I posted it on my webpage, on my Facebook page a few weeks ago. I made them surgical caps and masks, and they took pictures of themselves and they posted it on LSU's webpage. So of course, it's LSU material.
Yeah.
So, yeah, but it's a new fund. And when I went to Dr. Nair 2 weeks ago, she said, right now, you're the main fundraiser for our fund.
Wow. Okay, good.
Because it's so new, and because COVID has really put a stop to our fundraising. We were supposed to have a TLT, and we were supposed to have a big soiree at the end of September is Ovarian Cancer Month. And it all had to be canceled. So we're just going to do a Zoom this year and ask for donations. And I will include you on the Zoom, both of y'all, so that you can make a little donation. I'm not afraid to ask for it because it doesn't go to me. It goes to women who need their help.
That's good.
Just like all of us.
It's like I'll have your wine link open, so I'll post your wine link. So if people want to buy wine, anything that's bought through that link specific for your event, 10% of anything that's purchased will go back to you.
That would be wonderful.
So yeah, so whether it's one bottle of wine, whether it's a gift set, whether it's a case of wine, you know, it 10% will
That
go.
would be wonderful.
So,
I
yeah.
have told my doctors about you,
Nice.
and they were very happy that your company does this.
Yeah, well, now you can share this link with them because I know that they need wine at the end of the day. They're
Good. And Sonia, you speak to so many women because our industry is mostly women. It would be a good thing if maybe you could work that into some of your classes. Make sure you go and check out, because ovarian cancer is the percent, you know, 1 in 78. So if you hit a crowd of 1,000 in the audience, 1 in 78 women will have ovarian cancer. That's a lot of women in that audience.
It is.